The first session will be about health challenges of Sustainable Development Goals, SDGs, and their impact on Corona. The session will be moderated by Dr. Iman Nuwayhid. Iman was until recently, and for so many years, the Dean of the Faculty of Health Sciences at AUB. So Iman will moderate the session and he will introduce the speakers. So my role for this hour is done. So I'll have to have fresh air a little bit for COVID. And here I have Dr. Salim Adib telling me, go out. So I'll go out. Thanks a lot.
Okay, good morning, everyone. Good morning from Beirut and the American University of Beirut. So are we ready for the session? Are we ready to start? Hello, Sharbil, are we ready to start? Can you hear me?
Yes, we are ready to start. We have Dr. Bassel Al-Yousfi and Dr. Habib.
Okay.
One thing for the participants who would like to ask a question, please send it to the Q&A coordinator. Okay, so at the end we can gather the questions and send them to the moderator of the session. Thank you.
Okay, thanks, Sharbil. I would like to start. So I'm Iman Nuwayhid, and as Najib mentioned, I'm Professor of Occupational and Public Health at the Faculty of Health Sciences here at the American University of Beirut. And I would like to start by really extending my congratulations and special thanks to AFID, specifically to Mr. Najib Saab and his team, and to the Department of Environmental Health at the Faculty of Health Sciences for pulling together an excellent report that responds to a sort of a core issue. I don't want to spend time in the introduction, but this report has focused on the interlinkages between environment and health. And what's really surprising to all of us, and I think our colleague from Bahrain mentioned that this relationship between environment and health is so basic, is so clear, and yet we're all asking, why is it so elusive when we examine policies? Why does it disappear when we're talking about policies? What other policies, developmental policies, health policies, environmental policies, we find that link between environment and health is absent. Although the basic concept that this report talks about, that if you have an unhealthy environment, it's only natural that if you have an unhealthy environment, that will impact the health of people as individuals and as community. So that's going to be more or less the focus of this first session. And I'm very, very honored to present two excellent panelists, not only renowned scholars in the region and internationally, but also personal friends and very special and dear to me. So we have two panelists. We have Dr. Bassel Yousefi, who will start in a minute. Dr. Bassel Yousefi is the director of the World Health Organization, WHO Regional Center for Environmental Health Action. This is a position that Dr. Bassel has assumed since August 2009. And before that, he served as the Deputy Regional Director in West Asia at UNEP. He's very well published. So in addition to the many reports he publishes under the center, he has published over 60 peer-reviewed publications, and he served also as associate editor of two major scientific journals. Also on the panel, we have with us Professor Rima Habib. Rima is a professor of environmental and occupational health at the Department of Environmental Health here at the Faculty of Health Sciences at AUB. She also serves as the chair of the department She is the co-editor with Mr. Saab of this 2020 AFID report. Her research has focused on the living and working environmental conditions of marginalized communities, and she has published over 100 publications, including articles, abstracts in peer-reviewed international scientific journals, book chapters, and reports. So this is my introduction of the two panelists, and I'm sure that we're all looking forward to listen to them. So there's a shift in the agenda. So we're going to start with Dr. Basil Yousefi and then follow through with Dr. Rima Habib, and then we'll open the floor for questions and discussions. I've asked the two panelists to limit their presentation to less than 15 minutes if they could, so that we're left with 10 plus minutes for questions. So Dr. Basil, it's good to see you, and the floor is yours.
Thank you very, very much. Thank you, Dr. Iman, Dr. Rima, dear colleagues, friends, excellencies. It is a great pleasure to be with you this morning on a great subject, actually. First of all, I would like to start with acknowledging my co-author, Engineer Mazen Malkawi, who is a regional advisor in the World Health Organization. Also would like to mention that for Dr. Mike Ryan, it's not only the COVID-19 pandemic, but also WHO is having its World Health Assembly going on now. It started yesterday, and therefore our governing body is totally in session. So I think this would not reduce the importance of the topic, but actually it is a very busy time for WHO and the world facing this issue. I hope you can see my presentation. I shared it already. Is it uploaded?
Yes, Dr. Basil, if you please make it full screen only.
Okay. I'll start with some principles of the WHO. Basically, WHO has been working on issues related to health and environment since its conception 75 years ago. But the center here in the Regional Center for Environmental Health in the region was established in 1985. So basically we were ahead of the game, but our principles are based on issues related that there is no healthy community in a contaminated environment, nor we can have a clean environment in a sick community. So these are interlinkages that are very much important in understanding the subject and building the foundations. 1/4 of the burden of disease in the world, whether it is mortality or morbidity, is due to environmental risks. So this is based on our estimate as WHO. We are lately hit by the COVID-19 pandemic, which is perhaps the largest pandemic that hit the world in the last few decades. But we look at it in WHO as an opportunity for building a resilient, equitable, healthy, and green recovery. So it is a dilemma, but it is an opportunity at the same time. Unfortunately, we need to look at a new way of approaching the environment and health, basically divert from the traditional therapeutic approach of treating diseases and symptoms to improving determinant of health, including the environmental health. So basically the preventive approach rather than the therapeutical approach. From economic perspectives, our estimate as WHO that 10% of the GDP is spent on basically secondary and tertiary treatment, and less than 0.5% is spent on primary care as well as prevention. So the picture is totally skewed. So we need to work together on changing it into the right path. We have in WHO a strategy on health and environment, and it is based on a few pillars. One is scaling up primary prevention, as I have mentioned already. It cannot be done by the health sector alone, or by WHO, or by UNEP, or by the environmental sector. It is a cross-sectoral action, and basically we need to strengthen the health and the environmental sectors in order to lead these issues. We need to build support, basically strengthening the governance of the health and the environment sectors to create demand for healthy environment, including civil societies and NGOs. And we need to build it on evidence and on information, which is unfortunately very much lacking. And if it exists, as have been mentioned earlier, it exists in silos. So basically we have environmental monitoring data, and we have health surveillance data, but these are not interconnected in many cases, and we don't understand the causality that exists on local basis. Also, we've been working with the League of Arab States, as well as UNEP, in the last few years, and we have developed the Arab Regional Environmental Health Strategy. It was conceived in 2017 to 2030, and it was endorsed by the Arab Summit in the year 2018. It has 9 priorities, environmental health priorities. Let me outline them to you: water, sanitation and hygiene, air pollution and health, food safety, chemical safety, waste management, environmental health emergencies, climate change and health, sustainable development or unsustainable development and health, if I may, and occupational safety and health. These are the 9 priorities that the Arab strategy has tackled. Of course, the environmental causality of diseases is well established and well known for everybody. Actually, let's take the case of indoor air pollution. It can affect heart diseases, strokes, respiratory infection, cancers, chronic obstructional pulmonary diseases, tuberculosis, etc. In general, we can say that about 92 diseases that can be quantifiably linked to environmental risks. So this issue is not only based on the experts' opinion, but the causality is very much quantifiable in terms of health risk impact assessment. This is a very interesting graph, if I may. If we add all these fractions of burden of disease, we'll add it to 100% of fatalities. But for example, let's take stroke. It occupies about 8% of the total death globally, but 3 out of 8%, which is about 45%, is due to environmental fraction. If we look at issues related to diarrheal diseases, for example, about 6% of the fatalities in the world is due to these acute diarrheal diseases, including cholera, etc. But more than half of it, so basically 3.5% of it, 3.5% of the total, which is more than 50% of the diarrheal diseases cause of fatalities, is due to environmental risks and environmental fractions. So this graph shows you really the quantifiable way of introducing the interlinkages between health and burden of disease, environment and burden of disease. The Arab countries are not totally homogeneous. Basically, we had, for the sake of prioritization, to classify them into 3 groups: the well-off, the middle endeavoring countries, and the lacking countries. Unfortunately, due to the emergencies that we are facing in the region, some of the Group 2 countries, that these are the middle income countries, have moved into Group 3, which are the group that is lacking from socioeconomic point of view, as well as from environmental health services. So the priorities are a bit different from group to group, but anyway, all of them are affected by environmental risks. For group one, these are the well-off financially as well as developmental wise. Probably the priorities are focusing on air pollution, exposure to chemicals, occupational health, food safety in terms of chemical hazards. For group two, actually, we have the double whammy. We have the group one and group three, but for group three, we still are struggling with water, sanitation, and health. So the basic environmental services are still lacking in these countries. Of course, climate change is a cross-border between all three or four groups, if I may say. If we are to simplify it a little bit more, we see that communicable diseases are more prevalent in group 3 and group 4 countries. Nonetheless, with the pandemic COVID-19, I think we are facing this outbreak in all countries, and perhaps the well-off countries are suffering a bit more than other countries due to the international travel and interactions. Non-communicable diseases are basically very much prevalent in group 1 and group 2 countries, basically the well-off as well as the middle-income countries. Injuries are prevalent in all three countries, and especially related to traffic. When we look at the picture regarding the mortality attributable to environmental and food safety risks, we see that about 1/4 or 23% of the burden of disease in our region, in the Arab region, is due to environmental risks. Annual premature mortality exceeds 675,000 premature avoidable mortality on annual basis. And the DALI, the last years due to disability and life years, exceeds 25 million yearly. So if we consider that we have about 400 million people in the Arab region, this puts into perspective that perhaps 3 weeks are lost every year from the good, healthy lives of people in the region. Let me mention that 23% is a bit lower than the world 25%, but unfortunately, our people die because of conflicts and wars more than they die from environmental risks. So to put things in perspective, not because we are environmentally better than the other regions, but because we have other problems to deal with. At the same time, let me say, a quarter of the burden of disease is across average, but when it comes to vulnerable groups, as well as children, for example, this number can go as high as 30% of the burden of disease. When we look at the health burden attributable to environmental risks in the region, we see that the major driver is air pollution, exceeds 55-56%. Toxic chemicals about 10%. Occupational health is about 10%. 10% also for water, sanitation, and hygiene services. Foodborne is about 4%, and other environmental issues is about 9 to 10%. Nonetheless, all of these are exacerbated, aggravated by the onset of climate change. So we are basically looking at increasing burden of disease. If we compare the region to the globe, we see that non-communicable diseases attributable to environmental risks are more prevalent than communicable diseases. This indicates that we have more countries that are in the middle class as well as in the well-off classification. Injuries also, we are a bit lower than the world. Having said that, and I talked about the heterogeneity of the Arab countries, let me put it this way: the gradient of the age standardized death in 100,000 population due to environmental risks varies tremendously between the lacking countries and endeavoring countries as well as the well-off countries. So basically, it varies from about 370 deaths per 100,000 per year to about 50 or 60 per year. So it's going from Somalia into Qatar, and you see it is varying exponentially. And in the middle, basically, we have some kind of plateau that indicates the countries that are in the middle income countries. If we are looking at issues related to air pollution, I think our region is the hardest hit. Basically, the average annual, in terms of particulate matter, 2.5 micron, we are averaging about 70 microgram per cubic meter. And this is not including the outliers when we have sand and dust storms. We are talking about the annual average. Nonetheless, the recommended number for WHO is about 10 microgram per cubic meter. So this is why we are 7 or 8 times higher than the suggested number by WHO. And let me add to that, 98% of the urban population in the region breathe air that is substandard to the recommendation of WHO. There is a study from Iran that showed that the interrelation between increasing life expectancy and if we meet the WHO particulate matter 2.5 micron guidelines, on average, our citizens will gain about 0.6, so basically more than half a year in their expected life, just if we lower the particulate matter from 2.5 to 10 micron per cubic meter. Let me qualify this by saying this goes up to more than a year, 0.2 in Egypt and over a year in Saudi Arabia. But we are also in a region that is infamous for naturally occurring sand and dust storm. Nonetheless, WHO has declared in 2013 that all particulate matters that are less than 10 micron are carcinogens, regardless if they are naturally occurring or they are man-made or anthropogenic. So basically, we need to look into this very carefully. And unfortunately, we still have very limited apportionment, chemical apportionment studies to distinguish between the silica and the black carbon. And therefore, our best estimate as WHO that 50% of the particulate matters are man-made. If we look at
Dr. Basil, your time is almost up, so you have less than 1 minute to wrap up, please.
Okay. In terms of water and sanitation, as I mentioned, we still are suffering the variation between the well-off and the struggling countries. Nonetheless, we still have about 25 million, which is a staggering number of people in our region that are still practicing open defecation. 74 million have no access to basic sanitation and 50 million have no access to basic water. In terms of food safety, again, we are struggling. Even for the well-off countries, we do not exceed the 70% capacity.
And Dr. Basil, you need to wrap up. You need to finish.
Yes. If you give me half a minute.
Okay.
In terms of climate change, we are the second most impacted region after Africa, even though our contribution to greenhouse gases is very limited. In terms of occupational health, also we contribute more than a quarter from occupational exposure to cancer prevalence. We look at it from opportunity point of view. WHO is working in the Agenda 2030 of SDGs. Air pollution to be reduced by looking at air pollution by 5% reduction, climate change, climate-sensitive disease by 10%, and we are working on reducing the drinking water services for 1 billion. Of course, our region is about 5% of the world, so we can make these calculations. Finally, I would like to leave you with this picture. If you hit at Mother Nature has the opportunity to hit back at us. We wrapped it in plastic, and it is wrapping up now in plastic. So tit for tat. Thank you very much.
Thank you, Dr. Youssef. I apologize for rushing you through the last few slides. And we'll just move to the next panelist. So Professor Habib, you're next, please. If you can, we can stick to the less than 15 minutes I would appreciate that. Thank you. Lima, you're on.
Okay, I will share my PowerPoint. Please let me know if you can see it.
Yes, we can. Yes, we can go on.
Okay. Good morning to all. Thank you, Iman, for the introduction. And hello, Dr. Basil. Nice to catch up with you. On behalf of my colleagues at the Department of Environmental Health at AUB, I thank the AFAD team, and in particular, Mr. Najib Saab, Mr. Sharbel Mahfoud, and Mr. Sada Asad for collaborating with our department in the making of this year's AFAD report, Health and Environment in Arab Countries. Despite the countless challenges that our country is going through, and against all odds, AFAD and the Department of Environmental Health were determined to have this virtual conference. Our common faith survived the challenges to underline the important linkages between the environment and health, which we hope will be picked up by the states and governments in Arab countries and elsewhere. This is a must for life on Earth to prevail. I also want to thank AUB team, without whom this conference would not have been technically possible. Gina Qurdahi, Maya Abu Khuzam, Muhammad Ghandour, and Joseph Azar. Thank you all. Also, I would like to welcome our students at AUB and other universities who have joined the conference today, and I hope that we will be meeting face-to-face soon, observing social distancing. My talk this morning on health as a uniting sustainable development goal in the Arab world is based on Chapter 2 of this year's AFAD report. First, I want to acknowledge my two bright students in the Graduate Environmental Health Program at the Faculty of Health Sciences at AUB, Nathalie Haddad, who had a major contribution to this work, and Shelby Surdick from the US, who had come all the way from Alaska 3 years ago to do her Master of Science in Environmental Health here with us at AUB. They are both my co-authors on this chapter. Today, the world is in the midst of a global pandemic. But before I talk about the COVID-19 pandemic and its impacts on the Arab world, let me take you 5 years back to September 2015, when countries of the world adopted the 2030 Agenda for Sustainable Development at the UN General Assembly. The agenda included 17 Sustainable Development Goals referred to as SDGs, guiding global action towards achieving a sustainable future for all by the year 2030. The third Sustainable Development Goal, or SDG 3, aims to ensure healthy lives and promote well-being for all people at all ages. It includes 9 targets on which countries report their progress. These targets relate to a number of outcomes, including the reduction of maternal and child mortality, communicable and non-communicable diseases, and diseases attributed to environmental factors, in addition to achieving universal health coverage, amongst other things. SDG 3 also includes means of implementation, such as increasing financial support for early warnings, risk reduction, and management of national and global health risks. How is the Arab world doing on SDG 3, ensuring health for all, and the health and well-being of its people? The Emirates Diplomatic Academy, in collaboration with the Sustainable Development Solution Network, which is a global network for the United Nations, published the SDG Index and Dashboard report for the Arab world in 2019. This report showed that 14 Arab countries are moderately progressing on SDG 3, and 7 countries are stagnating. Only Oman was on track in maintaining SDG 3 achievements. The data is based on trend years ranging between 2010 and 2018. So it has nothing to do with the current situation. The national averages extracted from the World Health Statistics report published in 2019, more current, showed that the progress on SDG 3 targets vary drastically among Arab countries. Maternal mortality is an example. Although it has decreased over time in most Arab countries, the disparities remain with a high burden in low-income countries, including Somalia and Yemen, and a much lower burden in oil-rich, high-income countries, including Kuwait, Emirates, and Saudi Arabia. Despite the geographical proximity and the common borders, disparities between countries persist. For example, in Saudi Arabia, under 5 mortality rate is 12 per 1,000 live births, and the mortality rate attributed to unsafe water, sanitation, and hygiene services is 0.1 per 100,000 population. These rates jump to 385 per 1,000 live births and 10.2 per 100,000 population in Yemen. This is an illustration of the impact of poverty on population health. I also have here data from Lebanon and Syria, although the differences are not as pronounced. Aside from poverty, armed conflicts and political instability have a major impact on health and constitute a barrier to progress on the SDG in general, on the SDGs. According to the United Nations, chronic armed conflicts are a major challenge and impede improvements in global health. The Global Health Tracker that I show here on this slide identified 8 Arab countries in armed conflict or political instability. Actually, Yemen, Somalia, and Syria have been ranked as the first, second, and fourth most fragile states in the 2020 Fragile State Index. Displacements resulting from armed conflicts have impacted several countries in the Arab world. According to the UNHCR statistics, 6.7 million Syrian refugees fled to countries including Lebanon, Jordan, Turkey, and others. Lebanon have received alone over 1 million Syrian refugees that were spread throughout all its territories. This has stretched its weak infrastructure and healthcare services. Aside from direct casualties and displacement, armed conflict results in long-term political instability, destruction of healthcare systems, unemployment, and poverty, leading to major consequences on public health. A recent study published in BMC Medicine showed that indirect mortality among civilians increased by 81 per 100,000 population, excluding the direct battle-related death. The resulting outcomes that were most visible included communicable, maternal, neonatal, and nutritional diseases.
Rima, we can't hear you. Something happened?
Okay. I'm getting messages from the control room. Can you see me? The message say that the camera is not correct.
No, we can see you clearly, Dr. Rima. We can see you clearly.
No, so far.
So thank you for that. Apologies. I covered this slide, so I will move to the next one. On top of these health problems, the COVID-19 pandemic emerged at the end of 2019 and was declared by WHO as a pandemic and a global public health emergency on March 11, 2020. Recent history that we can all remember. Like elsewhere, the Arab world was hit by the COVID-19 pandemic. This map shows COVID-19 case fatality ratios as of September 30 of this year, based on the Johns Hopkins University dashboard. The numbers reflect the differences in available resources and testing capacities between countries. Yemen had the highest ratio, followed by Sudan, Egypt, and Syria, while the oil-rich Gulf countries had the lowest ratios. The outbreak uncovered the lack of emergency preparedness, the weak health systems, and the inability to mobilize resources for public health and patient care in most Arab countries, both rich and poor, and I underline that. The strict measures, including social distancing, airport closures, and country lockdowns that were adopted to control the spread of the virus have strained the economy. For example, Saudi Arabia scaled back the Hajj season in July 2020, allowing only 10,000 pilgrims who reside in the country to perform the Hajj rituals. This is compared to 2.5 million pilgrims last year in August 2019. The UNESCO projects a loss of $42 billion and 1.7 million jobs in the Arab countries. We have seen that with Dr. Badran earlier. Businesses had already lost $420 billion of market capital and $11 billion in net oil revenues between January and mid-March 2020. This created a concern for a ripple effect on countries that depend on remittances from oil-rich countries. Lebanon is an example. It is my bias that I live in Lebanon and that I am Lebanese, so I will use this country as a peculiar case study beyond reason. Recently, Lebanon has had multiple crises dealing with political instability, economic collapse, COVID-19 outbreak, and a disastrous blast in Port Beirut. The Beirut port blast resulted from the detonation of around 2,750 tons of improperly stored ammonium nitrate and was referred to by the BBC News as one of the largest non-nuclear explosions in history and the largest in the 21st century. And we talk about the environment. Over 200 people were killed and over 6,500 were injured. The explosion resulted in widespread destruction of dwellings, hospitals, and essential food and medical supplies. In an article published in The Lancet on September 10, 2020, I described with my colleagues the humanitarian crisis in Lebanon following the blast. The currency devaluation, the food price inflation, the poverty rates, the shortage of medicine, and the health personnel immigration escalated. In addition, COVID-19 cases tripled in August following the blast. Social distancing took a backseat as people responded to the emergency. A series of environmental shocks hit Beirut after the blast and its consequent destruction. And I order them in chronological order for you on this slide. A fire erupted in Beirut port on September 10, burning cooking oils and rubber tires that were stored at the site in the port. A dark smoke loomed over Beirut for many hours before it was controlled. And again, on October 22, a tornado hit the port of Beirut, dispersing the hazardous material that remained at the port site following the blast. The health impacts of these environmental health crises on the population of Beirut are yet to be determined. Let us revisit the SDG
just a time alert. You still have 1 minute to go.
Let us revisit the SDG Index and Dashboard report for the Arab world published in 2019, which I showed you earlier on this presentation. You can tell that the situation has drastically changed, not only for Lebanon that has undergone economic collapse and a series of environmental health catastrophes, but also for the rest of the Arab world that endured the health and economic consequences of COVID-19. What is next? Aside from having to produce a new dashboard and a new report on the SDG progress for the Arab world, dealing with a new era post-COVID-19 pandemic has imposed itself on the Arab world. The COVID-19 pandemic reminded us that infectious diseases do not live within geographical borders. Viruses spread beyond borders, which will eventually be reopened after lockdowns. It is useless to have country-specific health and safety policies in isolation. Policies need to be coordinated across borders. Health for all is a necessity. As the Arabic saying states, إذا جارك بخير أنت بخير, which translates into, if your neighbor is well, then you are well. Finally, I end my talk with a question addressed to all Arab states and governments. Can health unite the countries in the Arab world to reach the SDG targets and protect the health and well-being of its people? Thank you.
Thank you so much, Professor Habib. I think this was a very interesting presentation, and you've asked some challenging questions. Thank you, Dr. Yousfi, because you've also outlined the real challenges that are happening. I'm going to start while waiting for questions to come through from the audience. I'd like to start with you, Dr. Yousfi, and then another question for Dr. Habib. So and I'm going to be very candid, connecting to the comments of Dr. Habib towards the end of her presentation. So you've talked about three groups of Arab countries based on income. You've actually rightfully so spoke about the need to approach it differently, that we need to work together multi-sectorally, we need to build governance, we need to manage our priorities in a better way. But the reality is that there are sharp political divisions within the Arab region, within these groups and across these groups. So in your opinion, and based on your long experience as the director for a regional center for environmental health action, how can countries in the region transcend their political divisions to collaborate together on managing these environmental challenges? And if possible, it would be great if you can share a successful experience that you've sort of lived through, and maybe a less successful one. Fadlan.
Thank you very much, Dr. Iman. This is a very pointy question, but I'll be as candid as possible. And I'll put my hat as, let me put it this way, as a scientist rather than a representative of WHO. From political point of view, yeah, there are some kind of divisions within our region, and these are opportunities as well as challenges. If we look at the environmental issues, that, for example, pollutions cannot stop at the borders, at the political borders. They are transboundary, and basically they will go from one country to another for neighboring countries and for indeed neighboring regions. Therefore, we have no choice but to work together on basically preventing environmental risks. At the same time, I think health can be also a bridge for peacemaking. So basically, when we put them together, health and peace, we can work together on issues related to facing these challenges and these opportunities. At the same time, we have to look in the Arab region at the integrated opportunities. Many of our countries have challenges in terms of wealth. Others have maybe challenges in terms of workforce. Others might be agriculturally rich. Others might be rich in terms of oil and minerals. And therefore, if you look at the region as a region, rather than with the political boundaries and political challenges, I think we have a great opportunity to progress and achieve not only protecting the environment, the ecosystem, the biodiversity, but also human from all kinds of diseases as well as conflicts. Over to you.
Thank you, Dr. Basil, and you provided a segue to my question to Professor Habib. In your chapter, you've sort of touched on it in your presentation. In your chapter, you very interestingly, you actually referred to the SDGs 16 and 17. The SDG 16 talks about peace, justice, and strong institutions. The SDG 17 talks about partnerships. So how optimistic, from looking at the dashboards, looking at all these changes, you beautifully mentioned the unfortunate poverty in some of the countries, the armed conflict, the COVID-19, the overlaying things. How optimistic are you that Arab countries can really achieve the health and environment SDGs in light of the relatively poor performance on SDG 16 and SDG 17? And what can we do as professionals? I know that we're not political figures, but what can we do as environmental, as public health professionals? Rima, you're muted.
Okay. Am I mute? Am I on mute? Okay.
You're fine. You're fine.
Yes. Thank you, Iman, for this question. Yes, you are rightfully right. SDG 16 and 17 are closely linked to SDG 3, health. As I mentioned earlier in my presentation, progress on health requires stability, requires peace, requires building strong institutions. It also requires partnerships and cooperation between organizations, institutions, to reduce inequalities and support vulnerable populations in poorly resourced communities. The need for partnership, as underlined in SDG 17, is essential to provide development assistance, mobilize resources, and increase investment to address the needs in fragile countries, and sometimes in richer countries. Environmental and health professionals, as you have mentioned, what can they do? They need to have a voice. They need to build alliances and networks across the Arab countries. They need to push a health and environment agenda in partnership with advocates, in collaboration with the media that can be a strong advocate, and in linking with like-minded policymakers that can also help and assist in achieving this agenda. This could be a good start. Also, environmental and health professionals have a mandate. Let's not forget that. They need to work for all the population and not just for a selected group of the population. This gives them credibility, trust, and respect. They can use this leverage to rally more people around them and form alliances to work towards a safer environment and better health for all.
Thank you, Rima. I don't see questions here. Let me pull together some key points that the chapters and now the panelists have shared with us. Opening ceremony. Unfortunately, it took a pandemic that's killing millions of people to wake up the globe to the significance of the issue of environment and the fact that if we treat the environment badly, it comes back and bites us. So yet we're still living in a world that's quite unstable, that unfortunately in the midst of this pandemic, in the midst of the economic recession, we still see a lot of disagreements. We still see that the countries and the international organizations are not pulling together so to respond to these challenges. We see it also even at country levels. Rima, you mentioned Lebanon as striking a case study, where in spite of all the problems, we can't even form a government. And so how can you really respond to issues like this? And we still look around and see that the region is quickly being split into different political axes and groups. We need, I think, as environmental health people, as people who are involved in the health and livelihood of our communities, to be aware of our surroundings, to be aware of the reality of our situation. And I fully agree with you, Rima, that we need to work together to mobilize and connect across these borders. So I don't see questions there. I know that we've took a few minutes out of the break. So Mr. Saab, Najib, and Charbel, should we stop here because the following session is at I think is at 11. So
Thank you, Iman, very much. Thank you, speakers, for a very interesting session. Now, actually, we are administrating questions, so we told people to keep them for 12 o'clock Beirut time after the second session. So all the questions will be asked then. It is good to keep some time now in between, So we shall start exactly in 9 minutes for the second session, which is on air quality and climate change. So 9 minutes off just to get out for those who are indoor like us, do something, and we start exactly in 9 minutes at 11 Beirut time, 12 Bahrain time, 12 Amman time, or is it like Beirut? Amman is like Beirut, I think, Basit.
Yes.
It's like Beirut.
Yes.
It's
Yeah.
the same time now.
So just 9 to 8 minutes and we start again. Thanks a lot.
If I may, Mr. Saab, I would like to mention that today there is a meeting in the virtual meeting, let me put it this way, for the League of Arab States to basically tackle the issue related to the progress made on the Arab regional strategy on health and environment. So basically, all efforts are pouring into the same target.
Okay, now you have a break. So we'll all meet at 11 back at.
Thank you.